My name is Rachel Eikelboom. I'm a final year cardiac surgery resident here at McMaster, and I'm an investigator at the Population Health Research Institute. For Heart Month, I'd like to draw your attention to some of the major cardiac surgery trials that are being run out of McMaster. And I'd like to draw your attention not only to the clinical importance of these trials, but also to the speed and scale at which these questions are being answered. And I'll start with Dr. Richard Whitlock's LEOS 3 trial. This trial demonstrated that in patients undergoing cardiac surgery who have atrial fibrillation, routine performance of left atrial appendage occlusion reduces stroke. This study has changed cardiac surgery practice. It has been incorporated into international guidelines, and in the United States, it's a quality metric for cardiac surgical care. Building on the work of LEOS 3, the LEAPS trial expanded the same question to patients who are at risk of atrial fibrillation. LEAPS recruited 6,500 patients in about 600 business days, which is an absolutely unimaginable pace for most cardiac surgical trials. Dr. Emily Bellicote, a cardiologist who works closely with our group, is leading the investigator-initiated DANCE trial, which compares direct oral anticoagulants to warfarin in cardiac surgery patients. After 13 rounds of applications, this trial is now fully funded by CIHR and is actively recruiting here with over 400 participants enrolled at Hamilton General Hospital. Under the mentorship of both Dr. Whitlock and Dr. Bellicote, I'm leading a sub-study of DANCE called SUNDANCE, focusing on patients receiving new bioprosthetic aortic and mitral valves. We're interested in the potential role of anticoagulation in improving the durability of bioprosthetic valves. Sundance is funded by Heart and Stroke and by an early career grant from the Population Health Research Institute. It has opened 5 sites already across Canada and has enrolled its first 25 patients as part of the Vanguard phase. Now, what connects the 3 studies that I've described is not only their clinical importance, but also the infrastructure that really supports their success. Large surgical trials are not that common, first of all, but those that are out there take many years to complete. At McMaster, close collaboration between surgeons, cardiologists, clinical trialists, and the members of the research team allows trials to be completed at a pace that moves evidence into practice faster. And I think a key part of the success and momentum of these trials is that we are uh, leading recruitment here at Hamilton General Hospital. We are always a top recruiter in all of our own trials. So across stroke prevention, anticoagulation, and valve durability, the studies that I've introduced to you address everyday decision-making in cardiac surgery care. The work that's happening here in cardiac surgery at McMaster shows that when trials are run efficiently, answers arrive sooner and practice changes faster. Thank you and happy Heart Month.